Imagine this. You wake up with that burning feeling when you pee. The urgency, the pain. You do not want to go to a doctor. So you reach into your medicine drawer and find amoxicillin. It worked before, or at least you think it did. So the big question is, does amoxicillin actually treat urinary tract infections effectively? The answer is more complicated than most people realize. Let us break this down simply. Think of bacteria like tiny invaders setting up camp in your urinary tract. If they multiply, they cause pain, fever, and discomfort. Amoxicillin is like a demolition crew. It breaks down the walls of certain bacteria and destroys them. But here is the twist. Not all bacteria respond to amoxicillin. According to the National Library of Medicine, many UTI-causing bacteria have developed resistance to amoxicillin over time. That means, for many urinary tract infections today, amoxicillin simply will not work. So, what most people miss? They miss the type of bacteria. Yes, the type of bacteria matters. Most urinary tract infections are caused by E. coli, and many strains of E. coli have learned how to block amoxicillin from working. Think of it like invaders building better armor. So even if you take amoxicillin, your symptoms might only improve halfway, then return stronger. This can turn a simple UTI into a recurrent or more serious infection. So now, when does amoxicillin work? It is very simple. Amoxicillin can be effective only if the bacteria in your infection is still sensitive to it. This is why doctors often order a urine culture. It is like sending a sample to the lab to check what bacteria is causing this and which antibiotic will defeat it. This is not guesswork. It is strategy. The World Health Organization notes that antibiotic misuse is one of the main causes of resistance. Then, what are the common antibiotics that work better for many UTIs? Here is the list. According to clinical treatment guidelines, there is nitrofurantoin, trimethoprim or sulfamethoxazole, and fosfomycin. These are often used as first-line treatments for uncomplicated UTIs. It is very important that only a doctor or qualified health provider confirms the appropriate treatment. They have the expertise to identify the type of infection and the specific bacteria prevalent in a particular locality, which is essential for choosing the correct medication or intervention. Here is another point. Why taking the wrong antibiotic is risky. Taking amoxicillin when it does not work does not just waste time. It can teach bacteria to become even stronger. The FDA warns that stopping antibiotics early, or using the wrong ones, makes future infections harder to treat. Even a small misuse today can affect your health months or years later. So, what are the safe instructions if you are prescribed amoxicillin for UTI? Take every dose. Do not skip. Drink plenty of water. It helps flush bacteria. Do not stop early, even if you feel better. If symptoms do not improve in 48 hours, then contact your doctor. The National Institutes of Health, USA, notes that completing the full course is essential to fully clear the infection. So here's the simple truth. Amoxicillin can treat some UTIs, but not most. It is only a hero when the bacteria it fights still respond to it. The right antibiotic is the one that matches the bacteria causing your infection. If this helped, check my playlist for more clear medicine guides. The link is in the description. And share this with someone who might be guessing their antibiotics right now. Your health is worth the right information.